Have you noticed that maintaining a firm erection isn't as reliable as it once was? It's frustrating when your body doesn't respond the way you want during intimate moments. When erections don't last long enough, it affects not just physical satisfaction, but emotional connection too. Today we're going to discuss what happens when you keep losing erections too early, why this occurs, and most importantly, what you can do about it. The good news is that understanding the physical and emotional factors behind erection difficulties is the first step toward finding effective solutions. When erections don't last as long as you want, there's a lot happening inside your body that you can't see. The main issue is that blood isn't staying trapped in your penis long enough to keep it firm. Think of your erection like a balloon. It needs to be filled properly and sealed tightly to stay inflated. As men get older, this system often doesn't work as well as it once did. Your penis has two chambers that fill with blood during arousal. When you're younger, blood rushes in quickly and gets trapped, creating a firm erection. But over time, the blood vessels that carry blood to these chambers can become narrower or less flexible. This means less blood flows in, and what does get in might leak out too quickly. Hormone changes play a big part too. Testosterone is the main sex hormone for men, and it naturally drops by about 1% each year after age 40. When testosterone levels fall, you might find it harder to get interested in sex, and your body may not respond as strongly when you are interested. Low testosterone can make erections weaker and harder to maintain. The nerves in your penis are also important. They send signals between your brain and your penis when you're aroused. These nerve pathways can become less sensitive over time, especially if you have health conditions like diabetes. When nerves don't work as well, the signals get weaker, and your penis might not stay firm. Your overall health has a big impact on your erections. Problems with blood flow anywhere in your body can affect blood flow to your penis. High blood pressure, high cholesterol, and heart disease all make erection problems more likely. In fact, trouble with erections can sometimes be the first sign of heart problems, showing up years before other symptoms. Many common medications can also affect your erections. Blood pressure medicines, antidepressants, and some drugs for prostate problems list erectile difficulties as a side effect. Even over-the-counter cold medicines can temporarily make it harder to maintain an erection. Your mental state matters a lot too. Stress, worry, and feeling down can all make erection problems worse. When you're stressed, your body releases hormones that can interfere with sexual function. Even worrying about losing your erection can create a cycle where anxiety makes the problem worse. This performance worry can turn a small issue into a bigger one. Sleep quality affects everything from hormone levels to energy and mood, all important for good sexual function. If you're not sleeping well, this could be part of the problem. Many men find that improving sleep helps their erections too. Despite these changes, this doesn't mean your sex life is over. Your body is changing, but understanding these changes is the first step to dealing with them. Many men enjoy satisfying sex lives throughout their later years by learning to work with these natural changes rather than fighting against them. Do you find yourself feeling frustrated or worried when these issues happen? That's completely normal, but there are ways to manage both the physical and emotional aspects of this challenge. Studies show that about 50% of men over age 50 have some level of erection problems. This is not just a few isolated cases, it's a common part of getting older. Research has found that erection issues often start years before other health problems show up, making them an early warning sign worth paying attention to. Blood tests often show that men with erection problems have higher levels of inflammation in their bodies. This inflammation can damage the inner lining of blood vessels, making them less able to expand and let blood flow in. When researchers look at men with long-term erection difficulties, they often find that these men have poorer circulation throughout their entire bodies, not just in the penis. Brain scans during arousal reveal another interesting fact. Men who can maintain erections show strong activity in areas linked to pleasure and weak activity in areas linked to worry. Men with erection problems often show the opposite pattern. Their brain's worry centers light up, overriding the pleasure signals. This helps explain why worry and stress can directly affect your physical response. Some of the early signs that erection problems might be developing include taking longer to become fully hard, noticing softer erections than before, or losing firmness during sex even when you're still mentally aroused. Morning erections might become less frequent or less firm. These changes often happen so slowly that you might not notice them right away. Weight gain around your middle can be a warning sign too. Fat tissue can turn testosterone into estrogen, throwing off your hormone balance. Men with larger waistlines are more likely to have trouble with erections compared to men with trimmer waistlines, even if they're the same age. The food you eat affects your erections more than you might think. Studies have found that men who eat more fruits, vegetables, whole grains, and fish have better erectile function than men who eat lots of processed foods, red meat, and refined grains. This is because plant-based foods help your body make more nitric oxide, the chemical that helps blood vessels open up. Exercise has been shown to improve erection problems in multiple studies. One study found that just 30 minutes of walking each day reduced the risk of erection problems by 41%. Another study showed that moderate exercise worked almost as well as medication for some men with mild to moderate erection difficulties. Sleep studies reveal that poor sleep lowers testosterone levels and increases stress hormones that interfere with erections. Men who get less than 6 hours of sleep regularly have testosterone levels similar to men 10 years older. Getting enough quality sleep can help restore hormone balance. Quitting smoking can make a big difference too. Research shows that men who stop smoking often see improvements in their erections within just a few weeks. This happens because smoking damages blood vessels and reduces nitric oxide, the chemical needed for erections. Hit the subscribe button if you appreciate health advice. It helps us create more content you can use. Certain foods may help improve blood flow. Watermelon, beets, spinach, and dark chocolate contain compounds that help your body make nitric oxide. Foods rich in zinc like oysters, pumpkin seeds, and crab can support healthy testosterone levels. Adding these foods to your diet might help improve your erection quality over time. Your body has a remarkable ability to heal and improve when given the right support. Even men who have had erection problems for years often see improvements when they make positive changes to their lifestyle. How much better might your erections be with just a few targeted changes to your daily habits? While medical treatments like Viagra and similar pills can help many men, they're not the only option, and they're not right for everyone. These medications work by boosting blood flow to the penis, but they don't fix the underlying causes of erection problems. They also come with side effects like headaches, facial flushing, and sometimes vision changes. Men who take certain heart medications cannot use these pills at all because the combination could cause a dangerous drop in blood pressure. One common myth is that losing your erection means you're no longer attracted to your partner. This simply isn't true. Physical changes in blood flow and hormone levels can affect erections regardless of how attracted you are to someone. Many men feel shame about this issue and pull away from their partners, which only makes the problem worse. Open communication with your partner is often more helpful than suffering in silence. Another widespread myth is that erection problems mean your sex life is over. In reality, many couples find that this challenge leads them to explore new ways of being intimate that don't rely solely on penetration. Some men report that this actually improves their overall sexual satisfaction because it encourages more touching, talking, and connection. Some men try to fix erection problems by pushing themselves to perform, which usually backfires. The pressure creates anxiety, and anxiety makes it harder to maintain an erection. A better approach is to take the pressure off completely. Focusing on pleasure rather than performance often helps the body respond more naturally. Alcohol is often seen as a way to relax and enhance sexual experiences, but it actually makes erection problems worse. Even 1 or 2 drinks can interfere with the nerve signals needed for an erection. Many men find that cutting back on alcohol improves their sexual function within just a few weeks. Some herbal supplements claim to fix erection problems quickly, but most lack solid research backing them up. A few have shown promise in small studies. Ginseng may help improve blood flow, and L-arginine, an amino acid, helps the body make more nitric oxide. But unlike prescription medications, these supplements aren't strictly regulated, so quality can vary widely. On the practical side, pelvic floor exercises can make a big difference for many men. These are the same muscles you use to stop urination midstream. Strengthening them by tightening for 5 seconds and releasing for 5 seconds, repeated 10 to 15 times several times daily, has been shown to improve erectile function in multiple studies. Weight loss, even modest amounts, can significantly improve erection quality. Losing just 5 to 10% of body weight has been shown to improve erectile function in overweight men. This happens because fat cells produce substances that interfere with testosterone and damage blood vessels. Managing conditions like high blood pressure and diabetes properly is important too. When these conditions are poorly controlled, they cause ongoing damage to blood vessels and nerves. Men who get their blood pressure and blood sugar under control often notice improvements in their erections as an added benefit. For some men, testosterone replacement therapy might be an option if blood tests show low levels. This can help restore sex drive and improve erectile function, but it's not right for everyone and requires careful medical monitoring. Have you considered how your daily habits might be affecting your sexual health? Something as simple as switching from sitting all day to taking short walking breaks every hour can improve blood flow throughout your body, including to your penis. Taking back control of your erection starts with small, consistent changes. Begin with a 20-minute daily walk. This simple habit can improve blood flow throughout your body. Add foods like watermelon, beets, dark leafy greens, and fatty fish to your meals at least a few times each week. These foods support the production of nitric oxide, which helps blood vessels relax and open. Consider talking to your doctor about checking your testosterone levels. If they're low, treatment options are available that might help. Even if you feel uncomfortable discussing this topic, remember that doctors deal with these issues every day. You deserve proper care. Pay attention to your sleep quality too. Poor sleep directly affects hormone levels and sexual function. Aim for 7 to 8 hours of quality sleep each night. Creating a regular sleep schedule and keeping electronics out of the bedroom can help improve sleep quality quickly. Managing stress is essential for better erections. Simple breathing exercises can make a big difference. Try breathing in slowly for a count of 4, holding for a count of 4, then exhaling for a count of 6. Repeat this for just 5 minutes whenever you feel stressed. This calms your nervous system and can help counter the stress response that interferes with erections. Don't underestimate the power of open communication with your partner. Many couples find that talking honestly about changes in sexual function actually brings them closer together. Instead of avoiding intimacy because of fear of failure, explore different ways to give and receive pleasure that don't create performance pressure. Be patient with your body. Most men see gradual improvements rather than overnight changes. The blood vessels and tissues involved need time to respond to healthier habits. If you've been experiencing erection problems for years, expect that improvements might take weeks or months, not days. Remember that sexuality remains an important part of human life at every age. Your body might respond differently than it did decades ago, but that doesn't make intimacy any less valuable or pleasurable. By understanding what's happening in your body and taking positive steps to support your sexual health, you can enjoy a fulfilling sex life for many years to come. Thanks for watching. Subscribe for more health advice tailored to your needs. Remember, your best years are ahead.